You're watching Virginia This Morning.
Welcome back to Virginia This Morning. Listen to this. It's estimated that 30 million Americans have diabetes, and 1 out of 4 of them don't even know they have it. And this is an illness that can lead to other serious problems and can lead to complications, including your feet, if not properly controlled. Dr. Mitchell Waskin, friend of Virginia This Morning from the Foot and Ankle Center, joins us this morning to tell us more about it. Doc, great to see you again, my friend.
Greg, nice to see
All
you.
right, listen, we were just talking about some numbers here, 30 million people, but you said that number could be much higher.
There's almost 90 million people that are pre-diabetics, which means they're at risk for getting diabetes. It's an epidemic in this country.
What is diabetes?
Basically, it's an inability to utilize the sugar in your system adequately. So the short answer is you tend to build up too much sugar in your system that gets into other structures, your nerves, into your arteries, and causes damage.
Okay, the next question is, all right, it's not producing enough sugar. How does that affect the feet?
Well, actually, if I would ask you a question, what you think the #1 complication is in diabetes that puts diabetics in the hospital, what would your answer be?
Too much walking.
Actually, I do these regular seminars at our clinic, one of which is on diabetes, and I always ask that question.
Yeah.
And the answers I get are, well, it affects your kidneys or it affects your eyesight. Actually, the #1 complication of diabetes that puts diabetics in the hospital are foot problems, and it's those foot problems that lead to the amputations in diabetics.
So we're talking amputations. This is serious. We're not just talking a fungus or a virus. We're talking amputations.
No, this is serious. I'm not a big statistic person, but let me throw out some statistics. 15% of diabetics are going to get an ulcer. 15% of ulcers go on to amputation. What people don't realize is within the first year after a major amputation, there's a 50% mortality rate. 50% of the people will die within 1 year after that first amputation, and within 5 years the mortality rate is 85%. That's actually greater than the mortality rate from breast cancer and Hodgkin's lymphoma combined.
Boy, doctor, tell us, is
significant.
this something that can be controlled so as to avoid serious foot problems, including amputation?
Here's the good news. It's not all bad news. It's actually very good news. It's been shown that if once a year you do what's called a comprehensive diabetic foot exam, just a simple, in-depth exam of the feet that really looks at the risk factors that cause these complications, that it reduces by 85% all these bad things that you hear about. Simple things. One of the important things is just looking at your feet once a day. Here's a little model I brought up of the foot. And
Hold this just like that.
And if you look here, there's a barely perceptible red area that you can see on here.
Just right on the heel?
Right on here, barely perceptible. But this is what eventually ends up forming ulcers, and what can eventually end up forming gangrene.
Boy, oh boy.
And amputation.
Have you seen a person suffering something like this?
Almost every single day we have someone come into our clinic.
With gangrene?
Yes.
And then at that point, what happens?
Well, at that point you need the amputation. So what we're trying to do is have people pick it up when it's at this stage here, and we stop the progression of it. And simply looking at your feet once a day, and if you see any areas, we tell people in our clinic that a standing rule in our clinic is look at your feet every day. If you see any red area or any little sore that's forming, you give us a call. We actually, regardless of how busy we are, will get that person in that day, because that's how you prevent the amputations.
You also have some shoes as well. Does that really make a big difference?
A huge difference. For people that have loss of feeling in their feet, decreased circulation, or foot deformities, it's been shown that a diabetic shoe will greatly decrease the risk of getting these pressure areas and gangrene. And a lot of people would never wear diabetic shoes because they look like these ugly orthopedic-looking shoes.
Right.
So what we ended up doing in our clinic, I actually hired a podorthist, a person who just specializes in shoes, and set her with the mission of finding shoes that actually didn't look like ugly orthopedic shoes. All of these shoes that you see here are actually diabetic shoes. You would never know that by looking at these.
Not at all.
That looks like a typical woman's dress shoe.
It's pretty stylish, I have to say.
A running shoe.
Right.
Yes, you would never know it. And since we've been doing this, now we find that a great majority of our people that need diabetic shoes are actually wearing them.
Tell us about the quality of life issue when it comes down to diabetes.
You have two options. Diabetes can just ruin your life and be absolutely horrible, or it could be nothing more than a minor inconvenience if you do just a few things. One, watch your diet, exercise a little bit, and take your medications. And in the case of the feet, look at your feet once a day, and if you see anything that doesn't belong there, you give your podiatrist a call.
For the people that don't know they have diabetes, what should they be looking for?
Well, actually, it's tough. If you don't know you have diabetes, all you really need to do is make sure that you see your primary care physician at least once a year and get a physical exam.
It's very, very important information. Save those appendages. Great to see you.
Nice
Doctor,
to see you,
it's always
Greg.
a pleasure. Great information. All right. For more resources on this diabetic foot care, fascinating conversation, just visit us online at WTVR.com/VTM. Doc, thanks so much.